My name is Dr. Günther Jonitz. I'm a surgeon by origin, but I'm the president of the Berlin Chamber of Physicians since 1999, so for a couple of years. So I'm the head of all doctors who are working in Berlin. And the task of my chamber is to take care of doctors in terms of qualification. So we are making the rules and guidelines to become a surgeon or a doctor for internal medicine or a gynecologist and so on. We have our professional law where we take care that doctors are behaving correctly. And of course, we are also giving advice to our government to promote a better healthcare. The COVID-19 pandemic is a unique challenge in the history of mankind since 1918, where worldwide we call it Spanish influenza hold its grip on all nations on Earth. And this challenge really is unique because it puts our healthcare systems at its borders. Not because the virus itself would be so dangerous, but the way of the spreading of the infection is unique. That means that you get infected by the virus, even if you yourself you don't know that you are already infected. So you have a contact to a maybe healthy-looking person, and 1 week later you are suffering from corona. That makes it very tricky and also very dangerous. The second thing is that coronavirus comes in one big wave. That's different to influenza. Influenza is a season lasting over about 5 or 6 months in autumn and winter. And because even if it's only a small amount of patients who really need hospital care, and an even smaller amount of people who need intensive care, the numbers of people intensive care are so high that we do not have the capacity to take care of all of them. And that's makes it very dangerous for everyone, even if you are not suffering from corona. But when you are suffering from a trauma, from a car accident, or from a stroke or myocardial infarction, and need intensive care, and there is no one because it's all occupied by corona patients, then it's a threat to everyone. From the political point of view, it makes it very tricky for the governments, because a functioning healthcare system is a sign of evidence that your government takes care of you as a people of a nation. And when you as a people of a nation see that there is not enough taken care by the politicians, then political uproar and social problems will happen. That's either very easy to answer or a little bit more difficult. So I try to start it from the easy point of view. As most healthcare systems are trying to take care in acute care, so many doctors and nurses and hospitals and everyone else is taking action, and they are taking action with a lot of flexibility and the art of improvisation. So we learn actually a lot that cooperation is more important than competition. From the difficult point of view, we learn that our systems normally are not prepared to take care of a pandemic of that amount. It's too big for our ordinary healthcare systems. And we come to the borders of our healthcare systems worldwide. And to make it a little bit more simple, if you look at the key elements of a system means institutions and people are working together following one goal. We learn from corona that our healthcare systems are in reality not a system, because the institutions are working one after another, or maybe even one against each other. And the goals that are followed by the different institutions normally are quite different. So the pharmaceutical industry wants to make money, the government wants to keep people friendly and peaceful, and the doctors and nurses, of course, wants to promote health. And so we have different institutions not working together in a correct way and not following the same goal. And this is the key thing that we all can learn from Corona. As we actually see, the disease had its origin in China. And now looking back, we know that the Chinese authorities started to take action much too late. The first signs of a new possible pandemia could be seen in December last year, and it took several weeks for the Chinese authorities to take action in sort of epidemiological activities, meaning containment, and we saw that happen much too late in Wuhan and in other parts of China. So this arises the question of who is leading the healthcare systems. And on the one side, authoritarian systems like the Chinese one have much more chances to really act from top down, in contrary to other systems like the United States of America, which is market-based, where it's very difficult to find a common language how to act upon Corona. We were not really at the front line of the nations who took action at first, but we have two big opportunities. The first opportunity is that besides the United States, no other country worldwide has more bed intensive care than Germany. So when you, for example, compare Germany with Ireland, Ireland has about 3 intensive care units per 100,000 inhabitants. We have 33, so 10 times more. So in terms of capacity for intensive care units, I'm really quite sure that we will make it with our capacities, which we, by the way, have doubled in the last 2 weeks from 20,000 to more than 40,000 intensive care units. The problem is that in Germany, the political responsibility for healthcare is based on federal law. So the Länder, so North Rhine-Westphalia, Berlin, Hamburg are responsible for care, but the place where all power is located, where money and power is distributed, is on the national level. So the federal level and the national level has to learn to act together, and fortunately our government has taken very soon good action, not only to take care of the medical effects of Corona, but also on the economic and social effects. So the first thing is don't panic. It's an absolutely unique thing, and one day we can tell our children we have been part of it. We have seen it directly. Second, please follow all the advice of physical distance, because the coronavirus cannot walk or fly. It is transported, and is transported by air. So keep distance, and maybe also wear masks. And thirdly, learn from it. It's not only the doctors and the political leaders and the healthcare insurance companies, it is the public who has to take action to promote better healthcare systems and better healthcare politics. The situation in Germany is only because of one reason so good, because the hospitals resisted political action to shut down about 1/3 of all hospitals in the last 10 years, which was the wish of insurance companies, the payers and the politicians. So the public is kindly invited to take action for better healthcare politics in terms of better care and, most of all, better cooperation.